NHS Forest is here to inspire and support health sites in transforming their green space for health and well-being and also for biodiversity. That can mean many things. It can mean creating beautiful therapeutic gardens, green cafes, green courtyards. It can mean having vegetable growing space so that you can supply the hospital kitchens. The health of living systems is inextricably linked to human health, and the wider living systems are what helps to create the air we breathe and the food that we grow. It's for that reason that it's important for hospitals to be thinking about biodiversity and really showing leadership by looking at the biodiversity of their own sites.
I think Mount Vernon Cancer Centre has learnt a huge deal from their involvement in the NHS Forest and Green Space project. Firstly, they have learnt what a motivating factor it can be for staff. The staff have really become engaged in this project in ways that we haven't seen before. We have learnt practical skills about how to care. We have gained knowledge from our work with the Nature Recovery Ranger. Part of that role is really engaging staff with nature and biodiversity, and we're learning a great deal more about that than we knew and the importance of connections.
Green space at health sites has been shown to be very beneficial for patients. For example, there's research that shows that for patients who are recovering from abdominal surgery, if they have a view of green trees out of their window rather than a view of buildings, then they'll have fewer complications, they'll need less pain relief, they'll have better emotional well-being, and they'll actually recover more quickly.
We've seen a significant impact on patients. Nature allows you to get in touch with a side of emotion that sitting in a sort of waiting room in a very clinical setting wouldn't allow them to be able to do. It's a more relaxed environment in which they tend to open up and have more sort of honest conversations about how they're feeling.
In my experience, which has been about 30 years in cancer, oncology patients need distraction and they need comfort and they need something else outside their disease and their treatment. So for them in the chemo suite here, for example, they've got great massive big windows, they can see outside, they can now come outside.
To have chemo treatment outside would be fantastic actually. I would have loved to have done that, again because you're part of nature. I think it's something different as well, you know, a change from the usual sort of hospital chemo ward setting to be able to come out here. You almost feel that you're not at the hospital, but you're actually, you know, in your own garden or your own space.
I think there has been a great deal of engagement on site. We've seen patients kind of walking through, using the walkway, taking time to sit and look in the environment, and that's been amazing. I've had more people suggest to me, oh, shall we make this an outdoor meeting, than has ever happened before. In fact, I don't think it had happened before, so that's been really, really nice. And I've had senior managers say to me, this needs to be on the agenda.
I think of the sort of time and effort that's spent in developing an outside space actually is an indication to our staff of the fact that their health and their well-being is as equally important to us as the care that we provide our patients. And I think COVID pandemic has really brought home the importance of health and well-being for all.
I think the benefits to staff for this sort of initiative are mental health, well-being, association with nature, and just being able to relax during, you know, the times that you have to get out and about, which is very limited in a high-pressure sort of working environment in healthcare.
So I've chosen to plant a hedgerow because it's good for birds, but it's also good for things like hedgehogs, the foxes, a whole host of different animal species. This hedgerow has been donated by NHS Forest. We have asked volunteers to come and help us plant it. So really the costs are minimal.
Staff are much more aware not only of the environment around them by going into that environment on a regular basis, but also the sort of the sustainability element of that environment and how fragile it actually is. If we don't actively look after the spaces around us, then actually we won't have the spaces there for us to be able to benefit from.
Having NHS Forest provide that sort of support and that incentive and just that prompt to take part is really, really important, because we want to get involved and we want to help out, we want to do what's right, but having NHS Forest just sort of put that there in front of you to say you can do this and here's the support you need has absolutely been brilliant.